Desiccated thyroid, also known as Armour Thyroid. This is a thyroid hormone. It's also important to note that this medication is on the Beers list. The only common dosage form for this thyroid hormone is a tablet. These tablets of Armour Thyroid come in 15 milligrams or 1/4 grain, 30 milligrams or 1/2 grain, 60 milligrams, which is equal to 1 grain, 90 milligrams or 1.5 grain, 120 milligrams or 2 grain, 180 milligrams or 3 grain, 240 milligrams or 4 grain, and 300 milligrams or 5 grain. Some other brands of this medication have some other strengths of tablet available, however these are not very commonly used. Some of those other strengths are listed here on the card. You can take a look at those if you're interested. Getting into indication and dosages, this medication is used for adult hypothyroidism of any etiology. For this indication, the patient is initially started on 15 to 30 milligrams per day for 2 weeks, and the dose is increased by 15 milligrams every 2 to 3 weeks. The dosing for this medication is highly individualized, so adjust dosage accordingly. This medication is also used to treat congenital hypothyroidism in children. If the child is 0 to 6 months old, give the child 4.8 to 6 milligrams for every kilogram of body weight per day. If the child is 6 to 12 months old, give 3.6 to 4.8 milligrams per kilogram per day. If the child is 1 to 5 years old, give 3 to 3.6 milligrams per kilogram per day. Another indication for this medication is for the treatment or prevention of various types of euthyroid or multinodular goiters, including thyroid nodules, subacute or chronic lymphocytic thyroiditis, and in the management of thyroid cancer. In these cases, larger doses than those used for replacement are required. Note that in acute emergency situations, when oral route is not feasible, use levothyroxine injection instead. The dose for this is listed on the card on the screen. You can check it out if you're interested. You'd also use levothyroxine for the treatment of myxedema coma and for thyroid suppression therapy as well. It's important to monitor thyroid-stimulating hormone when taking this medication. The exact mechanism of action is unknown, although it's thought to be due to protein synthesis control, resulting in a regulation of growth and development, an increase in metabolic rate, and an inhibition of the secretion of the thyrotropin by the pituitary, and also various effects on lipid and carbohydrate metabolism. Armour Thyroid may increase the hypoprothrombonemia effect of oral anticoagulants. Cholestyramine may decrease absorption. Armour Thyroid may decrease the therapeutic effect of digitalis or hypoglycemic agents. Free levothyroxine may be decreased when given with estrogens. Use of Armour Thyroid is contraindicated in patients with diagnosed but uncorrected adrenal corticosinsufficiency, untreated thyrotoxicosis, and in patients hypersensitive to any ingredient. Used with caution in nursing mothers, in patients with cardiovascular disorders such as angina pectoris or diabetes, and in patients currently taking oral anticoagulants. Adverse effects other than those indicative of overdose are rare, but they include weight loss, palpitation, nervousness, diarrhea or abdominal cramps, sweating, tachycardia, angina pectoris, headache, insomnia, and intolerance to heat. When consulting a patient about the use of Armour Thyroid, include the following points. Do not discontinue therapy without first consulting a physician. Notify a physician if signs of hyperthyroidism occur. This would indicate an overdose. Transient loss of hair may be seen in children, but recovery usually occurs. Store in a cool, dry place away from sunlight and children. If a dose is missed, take it as soon as possible, but if it's closer to the time of your next dose than the dose you missed, skip the missed dose and return to your normal dosing schedule. Do not double doses. Contact a physician if the above side effects are severe or persistent. This concludes the Armour Thyroid drug card.